But one thing that Retina UK does is we collaborate a huge amount with other organisations, with our professional network, with the likes of RNIB, and one of the projects we've been supporting on is the sight loss pathway. And to tell us a little bit more about that and how you can feed into that, I'd like to introduce Rob Cooper.
Thanks, Matt. What an excellent speaker that was before us. So hopefully I'm going to explain about some of the work we're trying to do to actually change experiences that people are having in the clinical setting. But first of all, I just want to give you 30 seconds to reflect back on that conversation. I don't want you to say anything. I'm just going to give you 30 seconds with your thoughts. Okay, starting now. Stop there. Quite a long time, 30 seconds, isn't it, without any information, just sat there listening or taking in your own thoughts. It's quite daunting at times, being left alone. So, what are we trying to do at RNIB with our sector colleagues? We're trying to innovate a sight loss pathway. Well, that's where the journey started. So you've all taken a journey to get here today. You've all been given excellent information about how to get here today. You've all got an excellent pack. What a pack this is. I was looking at it on the train last night. It had all the information you needed to get here today or how to log online. Really, really brilliant pack of information that helped you on your journey to be in this room today. And you've all got here. I don't know how well your journey was. Most of you probably came on the tube. Can I just ask who came on the tube? Yeah, quite a few of us came on the tube. But you all got here because you came on a journey, but you got some great instructions and information. So thank you, Retina UK. And there's even a nice little section about myself, so I don't need to tell you who I am and what I'm trying to do. So why innovate a sight loss pathway? I think, does this clicker work? Is this the... Okay. You're all professionals working in this sector, so I'm not going to labour the point. Our eye health and eye care pathways are at crisis point. The demand that is coming into the NHS is not sustainable the way it is. And for everything we've just heard by Jocelyn, you know, it is at breaking point, and people are not getting the right support and information they require on that pathway. We know that up to 100,000 people a year are given a significant life-changing diagnosis. We know a further 700,000 people will be diagnosed with some sight-threatening condition like cataracts, for example, or glaucoma, or macular degeneration, or a retina condition. Every day, 250 people start to lose their sight, and the demand for eye care is at an all-time high. I think in England at the moment, we've got about 630,000 patients waiting to be seen in ophthalmology care. Staggering, really. What else do we know? We know, unlike the cancer pathways and other significant health conditions, there is no end-to-end support pathway. We've just heard there about the importance of support at that diagnosis, the importance of getting access to someone like an ECLO. We know that advice and support and information is not automatically embedded within our clinical pathways. We've just heard all those stories about people being hit by a brick wall. It needs to change. It needs to change. We know that our pathways are not person-centered, and we know that advice and support about that journey is not available at every stage of that person's journey. What else do we know about eye health? We need to improve the nation's health literacy. We need to improve the nation's eye health literacy. We can only do that if we improve the information and support that we give to patients as they come into our clinical pathways, or whatever journey they may be taking. Today, you've had a pack. You've been sent that online. It's available on a website. It's available in hard copy. The formats are endless that this information was provided to you with. So we know that there's a crisis in the UK around the levels of literacy levels, and that impacts on people's health. In the UK, 7.1 million adults read and write at or below the level of 9-year-old. I did a piece of work 10 years ago in a northwest city, and we were pulling together some health literature, and we was told that we had to pitch that at a 6-year-old. Yeah? 6 years of age, we had to pitch health information because of the standard of the nation's literacy in that city. And we know that this is having a negative impact on people's journeys through things like the eye care or sight loss pathways that we've got today. So 43% of adults do not have adequate literacy skills to routinely understand health information. 61% of adults do not have adequate numeracy skills to routinely understand health information. So we need to start improving the way in which we provide information, support, and advice to our community. I'm going to stop there and give you another 30 seconds just to take in what I've just said. Okay, I'll continue. So, in collaboration with NHS England, Anglia-Ruskin University, Canary 4, we started to look at what are people's experiences across our pathways, across our health conditions. We identified from a literature review and some work that we did with Canary 4 that there was 109 pain points across our pathways. We've heard about some today, you know, that diagnosis like a brick being thrown at you. We've also done some work closely with NHS England. The problem is that navigating the pathway is complex and confusing for patients. The problem is that the support is not person-centred. The problem is that the patient support is not triggered automatically or built into all our pathways. The problem is that there is no formal links to support services like Retina UK, RNIB. The problem is that there's a lack of funding for support staff as they are not part of the core funding of healthcare services. The problem is that support that does exist isn't distributed evenly across the country. The problem is that the support that does exist is not given consistently to all patients. We're probably preaching to the converted in this room. The fact that you're here today engaging is a good sign because you want to probably change, you come to learn, to improve, to develop. We need to improve our pathways. So what have we been doing specifically? We took all that literature. We decided we needed to go out wider to our community. So we've been doing some specific work with all our charity partners to really get to understand what this high care and sight loss pathway looks like. So we worked with Retina UK to understand the specific pain points that were experienced, and we've just heard a load of them there. What a great presentation, really highlighting some of those challenges that we've got. Some of my colleagues went around the country to engage with some of your groups, like in Manchester, Wrexham and Kent, and we started to map out what that pathway looks like for people. We co-designed the pathway, working with people with lived experience, third sector partners. I think in total we engaged with over 400 patients about the challenges that they were facing and how could we improve the pathways going forward. So I thank you all for being involved in that engagement process. We've been collaborating with our third sector partners. We're continuing to collaborate with our third sector partners to really make sure that we can get the right messages to our professional audience and then in the future to our lay audience as well. We've been working closely with the NHS, with third sector partners, with government, with social care professional bodies, because we've got one opportunity. We've got one opportunity, and that opportunity is now to really get a grasp of our pathways and really make them work for us. I did some work about 12 years ago on COPD and lung cancer around making sure people got the support and the information at the right time on their journey. That pathway doesn't really exist anymore. Do you know why? Because 12, 15 years later, it's fully embedded. People don't question it. It is just part of that process. Nobody goes with as a cancer diagnosis without support just being put there in place, non-clinical support. And that's where we want to get to. We've developed a series of I statements to reflect what good looks like across each stage of the pathway. So I've got a word cloud, and this is basically taken from the information that was provided from the specific consultation events that we had with Retina UK groups. And some of the key words that are on this word cloud: time, support, information, referred, diagnosed, wrong, years, genetic. These are all some of the key things that were coming out of the consultation we had with your community. I'm just going to give you another 30 seconds just to reflect on that. 30 seconds is up. You might be wondering, why do I keep giving you 30 seconds? I'm giving you time to absorb the information. The NHS, our clinical practitioners, you probably don't have time. You're stacked, you're busy, you've got people knocking at your door every single minute of every day. You don't have time. So I want to give you time just to absorb the information that you've been given. Because that's what we need to give our community. We need to give them time to understand it. And clinicians might not be the best people to sit down and give that time. But I can guarantee our support services like Retina UK, RNIB, Macular Society, we have the time. We can give people time that they need to help them, support them on their journey. So where have we got to in terms of our eye care support and sight loss pathway that we're trying to create? I'm going to put a disclaimer on this next slide because it's not the finished article yet. We're still working on it. We've got a task and finish group at the moment tweaking this, but in principle, the main stages are there and the thematic areas are there that I want to share with you today. So this is what we've got, and this is what we've created in terms of an eye care support pathway. This is very generic. It's not condition specific, but we've tried to do is pull out all those support needs and pull them into what an eye care support pathway could look like for us and our community. So we've got a bit like a London tube map. Yeah, we've got stages and stations. I don't mind coming to London because actually the tube map's great. Once you understand it and you get to you know it, you can get anywhere across London within probably about half an hour. So we've got the first stage, having my initial appointment, waiting well, having my diagnosis confirmed, support after my diagnosis, living well with my condition. So they're the 4 key stages that we've identified in terms of key stages across all clinical pathways, and where we really need to start to think about how do we get support and information into those parts of the pathway. And you'll see we've got waiting well. 630,000 patients are currently waiting to be seen in ophthalmology. They're waiting. Are they waiting with a Retina UK information pack? Probably not. What kind of information have they been given at every stage to help them to understand that the journey that they're embarking on? You know, you've got great information to get here today, to this venue. Are we making sure that our patients are getting the right information at the right time on their journey? And we know that people are not waiting well. People are anxious. They don't want to come to the hospital. They've got fear. And we've got to try and ensure that people get information to really help them digest what's happening to them and give them the time to be able to talk to somebody or to digest that information at every stage of the pathway. And what we've come up with is 3 thematic areas of focus in terms of if we can get the support right, we need to make sure that people can understand their eye care journey, that they understand their diagnosis, and that they have access to emotional and practical support across each part of the pathway. So peeling back the pathway, because like I said, our pathway is very much generic. There's still probably many years of work that needs to go into this pathway to make sure it's specific to each condition, each eye condition. But this is some of the work that we've been doing with Retina UK to really look at what are some of the specific needs of people with a retinal condition. So I've access to a specialist eye care team, genetic testing, counselling if appropriate. I know that genetic testing is available to me and I've been referred for genetic counselling if required. I understand the next steps and how my condition will be treated, managed, and whether treatments are available to me. I have opted for genetic testing. I know my genetic diagnosis. I have been given specific eye health literature from a trusted source. You've not gone on to Dr. Google. I understand if my condition is hereditary and what that may mean to me and my wider family. I know about research related to my condition and how to get involved in clinical trials if I am interested. I understand how my condition may develop. So that's just a snapshot of some of the feedback that your community told us about the types of support that they need across this pathway. So what are the next steps? So we're hoping to publish the pathway, the support pathway, later this year, and that everybody owns it. It's not owned by RNIB, it's not owned by Retina UK, it's owned by everybody in the sector. So everybody will hopefully endorse this piece of work and implement it. Continue though, fundamental to this is to make sure that we continue to work with organisations like Retina UK to ensure that our clinical pathways incorporate those key support elements that we've identified. And we need those clinical pathways to embed support. And we need to collaborate for good. The NHS is broken. I have first-hand experience. My wife is a paediatric oncologist. She comes home in tears some days because of the challenge and the pressure that they are under. So I do empathise with the pressures that you guys are under. It is hard, but you're not there to do it alone. You've got organisations like Retina UK, RNIB, who can help you and who can help our community to really improve their lives and make sure that they can go on and live confidently with whatever condition they may be diagnosed. So before I just finish there, what I want you to do now you've had all that information, I'm going to give you a minute and I'm going to allow you to talk to the person at the side of you just about that presentation. So you've got 1 minute. Off you go. Thank you. just say thank you. Perfect. So don't worry. I've got 30 seconds. Okay for you? Okay, thank you. Your minute's up. Stop there. Okay, thank you, everybody. How much better was that 1 minute than your other 30 seconds? Much better. Why was it much better? Because you had somebody to talk to. You had somebody to collaborate with. Thank you for listening. My name's Robert Cooper, but you knew that because you had a great information pack. Enjoy the rest of the conference. Thank you.